Hello, hi everyone. So today let's discuss about what are the different types of poisoning and how to manage such types of poisoning. So first one, when you take the important poisoning is barbiturate poisoning. So these barbiturates are the drugs which mainly acts on central nervous system. It mainly acts as depressants of the central nervous system. These we will take it as sedatives. So these we will provide to patients as sedatives. So it acts as central nervous system depressants. Because of that, what happens is it causes sedation, and overdose of these drugs may cause death of the patient. So what is the classification of these barbiturates? You see, there are mainly ultra short acting barbiturates. In the name itself, it is there, ultra short acting. It acts only for greater than zero point 0.5 hours. It shows only greater than zero point 0.5 hours of duration of action. Example, thiopental, methotrexate, etc. And the next one is short acting barbiturates. Short acting barbiturates mainly acts greater than 3 to 4 hours of action. So it shows greater than 3 to 4 hours duration of action. Example, pentobarbital and secobarbital. And intermediate acting barbiturates, these shows greater than 4 to 6 hours duration of action. Example, amobarbital, aprobarbital, butabarbital, and butalbital. And long-acting barbiturates, as the name suggests, these acts for a longer time. These acts greater than 6 to 12 hours of duration of action will be shown by these long-acting barbiturates. Example, mephobarbital and phenobarbital. So the barbiturate poisoning mainly occurs due to these acts, the barbiturates, ultra short acting or long acting, this mainly acts on GABA receptors, gamma aminobutyric acid receptors. When they acts on GABA receptors, automatically these activates the GABA receptors. When GABA receptors are activated, it opens the chloride channels. So when it opens the chloride channels, these will prolong the duration of GABA gated channel opening, so that when it prolongs the duration of GABA gated channel opening, automatically these depresses the central nervous system. And the clinical symptoms of barbiturate poisoning mainly includes coma, circulatory collapse, rapid pulse. The pulse will be in a rapid, faster movement, cold skin will be there, and a slow or rapid breathing. Either the breathing of the patient will be slow, or either the breathing of the patient will be very rapid. And it also causes atelectasis and pulmonary edema, bronchopneumonia, and acute renal shutdown. And management of barbiturate poisoning. Barbiturate poisoning is mainly managed by one method. That method is called as Scandinavian method. In Scandinavian method, what the doctors will do is, first patient should be hospitalized. First, the patient should be taken to the hospital. And the second point is, the patient should be provided the support of vital functions like regaining the consciousness of the patient, regaining the airway of the patient, and blood circulation, providing good blood circulation to the patient. And the next step is preventing the further absorption of the drug. The barbiturate drugs further absorption should be prevented in the next step by doing some process like emesis. Emesis means nothing but vomiting. So by emesis, gastric lavage. Gastric lavage means nothing but emptying the toxic content from the stomach by using activated charcoal or any other method. Next point is increasing the elimination of the drug. So the drug elimination should be increased from the body, so that the drug should be totally eliminated from the body by using the techniques like diuresis and dialysis. And the next step is conservative management with good nursing care. So they should provide, the hospital should provide good nursing care to the patient so that he can feel well. And the last step is total detoxification of the toxic material from the body, and also providing some psychiatric help. Psychiatric help means nothing but providing some counseling to the patient such that the patient can feel comfortable in the hospital, and he can feel that he is safe in the hands of the doctor. So these are the steps which should be taken for management of barbiturate poisoning. The main method is what? Scandinavian method. In this method, first what we have to do, we have to hospitalize the patient, and then we have to support the vital functions, and we have to prevent the further absorption of the drug, and also we have to increase the elimination of the drug from the body. And also the next step is managing with good nursing care and providing some psychiatric help to the patient. This is the Scandinavian method of managing the barbiturate poisoning cases. Next one, morphine poisoning. So morphine, what is morphine? Morphine is nothing but it is one of the main alkaloid of opium. So it is the most used analgesic for chronic pain, but its use is limited due to induction of tolerance. Means the patient can tolerate it and the patient can be addicted towards this morphine. So that is why its use is controlled. During Second World War time, the soldiers used to take this morphine for relief of their pain. But the mainly 4 lakh soldiers are addicted to this type of morphine poisoning. So that is why this morphine use is totally limited by the governments. And management of morphine poisoning, mainly naloxone is the drug which is given for treating this morphine poisoning. This naloxone shows antagonistic activity, and also it shows rapid onset of action within 2 minutes when it is given through IV route. And the plasma half-life of this naloxone is 1 hour. Next, organophosphate poisoning. So what are organophosphates? Organophosphates are nothing but these are drugs which are used as insecticides, or it can be used in medications, and it can also be used as nerve agents. It mainly the organophosphate poisoning is occurred due to the exposure of the human being to drinking or breathing the vapors or some skin exposure of these organophosphates. What does these organophosphates do? These organophosphates mainly inhibits the acetylcholinesterase enzyme. When it inhibits the acetylcholinesterase enzyme, it leads to the buildup of acetylcholine in the body. Acetylcholine will be uncontrollably, it will build up in the body and causes muscle overstimulation. So when muscle overstimulation occurs, this causes disturbances of synapses, and paraoxonase is the main key enzyme which is involved in this organophosphate toxicity. The symptoms of this organophosphate poisoning is weakness, fatigue, muscle cramps, and paralysis of the body. And management of organophosphate poisoning, mainly the drug which is used for managing this organophosphate poisoning is pralidoxime. This pralidoxime, why it is used is this pralidoxime will restore the acetylcholinesterase activity in the body, and it also removes the overstimulation or bulky phosphate moiety which is present in the nerve terminals, and it also restores the enzymatic destruction of acetylcholine. And it also relieves the muscular paralysis. Whatever the paralysis caused due to organophosphate poisoning, it relieves that muscular paralysis. And the next one is lead poisoning. Lead is a highly toxic metal and is a very strong poison. It mainly occurs when lead built up in the body. Where this lead is found is, it is mainly found in the paints which you will paint to the walls, and whatever the wall paints are there, whatever some toys are there, those paints contains this lead. When some children, when they keep these toys in their mouth, the lead will enter into mouth and it causes this lead poisoning, and it is very, very harmful to the children. The damages of these lead poisoning cannot be reversed. Lead poisoning can be treated, but the damages which are caused by the lead poisoning, those cannot be reversed. So that is why the lead poisoning is very dangerous to the children. The symptoms of lead poisoning is mainly abdominal pain, cramps, aggressive behavior, constipation, some sleep problems, and loss of development skills in the children, memory loss, and kidney dysfunction problems. Management of lead poisoning, mainly the one which is used for treating this lead poisoning is calcium disodium editate, which is called as CDE. Calcium disodium editate is mainly used in the treatment of this lead poisoning. Why? Because it forms a chelate complex with the lead, and it makes the lead stable, and it makes the ring of the lead water soluble, so that it can be easily excreted through urine. After taking this, some of the scientists, they recommend that use of zinc and iron supplements after the CDE therapy can regain the body's functions. It is important to monitor the renal function also. The kidney function should be monitored while giving CDE. It may damage the kidney in higher doses. Next, mercury poisoning. You know, the mercury is found as a natural element in air, water, and soil. Where this mercury poisoning mainly occurs is in water. Why? Because the fish and the shellfish and other types of fish, they will eat this mercury. The animals which eat these fish, they will take the mercury from the fish. And also humans who eats this type of fish, they will get mercury from those fishes, and those undergoes the mercury poisoning. So, and also some fluorescent bulbs which excites some mercury vapors are also one of the reason for this mercury poisoning. Mercury poisoning at higher levels, it can harm, it can damage the brain, heart, kidneys, lungs, and immune system of the human being. So that is why mercury poisoning is one of the dangerous poisoning. The symptoms of this mercury poisoning are mainly impairment of vision. The eyes you cannot see, you cannot watch the objects properly. That is impairment of vision, and a needle like sensation will be there on your hands, legs, and body, and muscle weakness will be there, tremors and convulsions are there, and emotional changes will be there in the patients, and also headache is also present in the patient who is suffering with this mercury poisoning case. And management of mercury poisoning, mainly the drug which is used for mercury poisoning is dimercaprol. This dimercaprol, it forms a chelate with the mercury and other metals, and it makes this mercury readily excreted by the kidney, so that it can be excreted easily from the urine. So alkalinization of urine may protect the kidney during the therapy. You should alkaline the urine with some drugs so that it may protect the kidney during this dimercaprol therapy. And dimercaprol is more effective when you give it after the immediate exposure to the mercury poisoning. And also another drug is also there which can be used for this mercury poisoning, that is penicillamine. This penicillamine also forms a chelate like a dimercaprol, and it is readily excreted through urine. Next, and the last one is arsenic poisoning. Arsenic is also a natural semi-metallic chemical. It is found all over the world in the groundwater. It is mainly found in the groundwater like wells, bores, like that. How we can take is we can take this arsenic by swallowing, absorbing, or inhaling the chemical. When you are exposed to it can cause death if not treated properly. The symptoms is common symptoms like drowsiness, headache, confusion, diarrhea. Some swallowing problems will be there, and sometimes there will be blood in urine, hair loss, stomach cramps, convulsions, and vomiting cases are also there with these arsenic poisoning affected patients. Management of arsenic poisoning mainly depends on the type and stage of poisoning the case. Mainly the things which we have to do for these arsenic poisoning patients are remove the clothes which are contaminated with arsenic, and wash and rinse thoroughly the affected skin of the patient, and blood transfuse blood when affected seriously, and take some hot medications. If heart starts failing in using the mineral supplements, if heart doesn't take the mineral supplements from the blood, then heart medication should be taken to control the heart problems. And also bowel irrigation. Bowel irrigation is nothing but cleaning your bowel, cleaning the stomach by passing a special solution. The gastric intestinal tract of the patient should be cleaned, so that if any arsenic traces are there in the stomach, then it can be taken out from the body, eliminated out from the body. So this is the management which we will use for arsenic poisoning. So these are the different types of poisoning and their management. Thank you. Subscribe to my channel for more and more pharmacy classes. Jai Hind.